Katie, do you want to take off from there and then we'll.
Sure, absolutely. I just want to echo what Justin said about your path has not been easy the past several years as students, wherever you are on this road. And I've been very drawn to thinking of where you all must be in this process and things that you have been denied in your Loyola experience, and also knowing how grateful I am that you have been there, because I know what the Loyola community and the Loyola family does for one another. I am the oldest of the three of us, I believe, and my freshman year was 9/11. So I was 2 weeks into undergrad, and the bombing of the World Trade Center happened. And the ensuing 4 years of college held the Iraq War, and with it, Iraq War protests. And so I think often as we look at what is happening in Ukraine and what I was a witness to and how that formed my 4 years at Loyola, know for each of you that this must be even more intense because of the ways in which we experience all that is happening across the world. And then also knowing that this has come simultaneously during a pandemic that has touched every human in probably a way that nothing else has and hopefully nothing else will, has touched every human on earth and impacted us in such different ways. So to be continuously living trauma while other traumatic events are happening, while you are experiencing what should be some of the, and hopefully will be and are some of the best years of your formation. I am grateful that you guys are all at Loyola and have that community around you. And I couldn't agree more with Justin about the formation of sociology. I similarly was somewhat late. I came in believing that I was going to go into education. I thought I was going to be, so I'm the opposite of Justin. I was convinced I was going to be a math teacher. And so I started heavy in education and math. And while education felt right, the lack of interpersonal experiences of math felt very distant and very isolating. And I think we're formed also just by what was going on in the world around me. It felt very abstract when what I wanted to be doing was building community. And so I similarly kind of looked around and I struggled. I was doing well in education, but I just couldn't make math work. And so I looked around and met Dr. Van and met many of the professors, and was formed by I was in a 101 class when the first plane or the second plane hit the towers, the Twin Towers, and I was actually a little early to class, and so it was on, this is going to date me, but there used to be televisions in the corner of each of the rooms. And so we were watching it, and people from surrounding offices were in Beatty Hall, and we were watching those moments happen. And it was because of the people who I was around at that moment, and actually it was my Psychology 101 class. And I will never forget feeling drawn to working with people in that moment. And it was during my senior year when my field placement was actually at Beans and Bread. So Beans and Bread in Fells Point was my senior year field placement. And I knew I had done quite a bit of service opportunities working with people experiencing homelessness, and had done the Caravan program, which had spent time and just really the essence of being with other humans, the gift of presence, and the importance of hearing people and listening to people and learning their stories and not assuming what made them who they are. And I think that so much of that came from my roots in sociology of wanting to understand the complexities of people, and seeing that so much of it was impacted by the world in which they exist. The person in environment is such a foundational concept that we go back to, but it is so essential in every relationship that we will ever create. And so I knew I was really drawn to wanting to work with people experiencing homelessness, and that's what I knew. And I kept bumping into during my field placement, kind of seeing people who were doing work that I wanted to do, and were just interacting with the world in ways that I wanted to be able to think about and address systemic issues. And I asked what degrees they had. And over and over and over again, I kept hearing, I have a master's in social work. I started in sociology. I went on and got my MSW because of an internship like this. And so that's what I did. My sociology degree launched me perfectly into an MSW program, and found myself, when I graduated from Fordham, so I went to a different Jesuit school for my MSW, and had an opportunity to return to beans and bread. So to return to where my field placement was. And it was because of those relationships and the experiences of learning about the systems within Baltimore. I don't have roots in Baltimore. I'm from Massachusetts. That is home to me. And that's where all of my roots were. But I fell in love with the endearingness of Baltimore, and began to learn about and understand the systems and the decisions that were made that kept this city to have this ivory towers of Hopkins and Loyola sit directly next to York Road and West Baltimore, and Northwest Baltimore. And the uniqueness of Baltimore is always that one block in any direction really changes the makeup. And one of the things I will never forget is that people less than 2 miles apart from each other, from Northwest Baltimore to the area around Loyola, have a 20-year difference life expectancy just by those zip codes. 21215 as opposed to the 21212 immediately around Loyola is a 20-year life expectancy difference. And so those are roots in sociology that I needed to understand, and I needed to know why the people who made up Baltimore for me were treated so differently by the systems that were built around them and built in response to wanting to cast out and marginalize people. And so recently I then went on to spend 9 years at Healthcare for the Homeless at the bottom of 83. So I am a clinical social worker. I do have a clinical license. And it was from my time at Healthcare for the Homeless at HCH that I started to look nationally at some of the systems level impact and policy. So with that same sociology route, I now work on the policy team for the National Healthcare for the Homeless Council, and have spent the past almost 2 years looking at healthcare policy impact at health centers that serve people experiencing homelessness. So I have, and I was sharing with Dr. K prior to this that as I joined, that I've used more of my sociology roots in the past 18 months at the council, as we've had the opportunity to really look at the events that are happening as a result of COVID, particularly for people experiencing homelessness, and find opportunities to develop research based on what is happening. One of the great things now that is so different than really ever before is the speed and the ways in which we can capture data, and that while we may not know how we want to use it, there is so much information in interactions that we can capture and then use to inform policy decisions. So I will say, from looking at, one of the big things that we have looked at are the housing interventions for people experiencing homelessness as a result of the pandemic. So most jurisdictions made this decision to put people in hotels because congregate living we didn't know much about COVID at the beginning, but we knew that close contact and people living on top of each other was no way to prevent or to address public health spread concerns. Turns out it's also not actually a way that people should live anyways. But we finally had some opportunity and policy, and most importantly, some federal money to put people in hotels and then track what their outcomes are. And the research that has come from this is absolutely amazing to see. And it is all sociology. And just as, as Justin mentioned, so essential to all of this is this equity lens through which we need to implement and change every policy that currently exists. Homelessness is a creation of our systems. It is very intentional. We keep it that way as a society. It is in no way anybody's fault that they are experiencing homelessness, but the structural inequities that exist and the systemic racism has never been more clear than as we've looked at this pandemic, where people of color have been disproportionately impacted by this illness in ways that we will not be able to correct for generations because of the number of people that have been lost. And it is the sociology lens that is going to help change and inform and hopefully correct some of these systemic inequities to move towards a way of really of creating reparations and really just looking at how we will create equity within healthcare. So one thing that I would just kind of leave with is I cannot speak more highly for the opportunities that a sociology degree affords you, and where it can lead you to, it can be connected to different things. So as I said, I kind of found what I wanted to do before I realized what path would get me there. It wasn't just from sitting in a class that I was able to identify. I didn't know social work. It was not as discussed and well respected in the early 2000s. But sociology gave me that path forward for it. And it can be applied in schools. It can be applied in healthcare. It is essential in the operations for large organizations in the business world to be considering the ways in which things such as equity to what our social impacts are. There is a place for you at every table that you want to be at. So I encourage you to not be limited by even just by what we say, although I will gladly loop anyone, I will hook anyone and tell you that an MSW is the most amazing degree. But I will say that there is a place for you with your sociology degree at every table, and that you should be making sure people make space for you because of the knowledge and, more importantly, the perspective and approach that you take. You are learning how to think analytically and to view the world in ways that many other majors do not consider. They're starting to, but we've been doing it, and your professors have been thinking like this and teaching these methods for so much longer than many of these others who are introducing it as you must check it off as a box and have a conversation or a one class that meets this equity requirement, whereas it is ingrained and interwoven in everything that you learn and will make you an invaluable team member at any table, whatever it is that you might decide you want to do.
Thank you. That was inspiring. I want to take sociology now. Mark.
Me
could
too.
you talk
I want to come back
Yeah.
and do it. Do we get like
I
another
mean,
one, you know, after so many years? You can say it's been 20 years since I've been there. Do I get another couple rounds?
I have a question for Katie. I was just wondering, so I'm kind of considering doing an MSW after I graduate. I'm a junior right now. But I guess, how did you know? I'm not sure if you went like right after you graduate Loyola, or how did you know like when to go, I guess, or also how did you know that you wanted to go there, I guess, exactly. I know you touched on it a little bit. Thank you.
Yeah, it's a great question. So I would say I did go immediately after, and that's because of my internship. So I would say, great thing about being a junior is you have this opportunity, and hopefully it will be in a world that is a little bit more normal, and you'll have the opportunity to really get into places, and actually experience work setting environments and get to interact with other professionals. Because I would say that's really how it was, is that I kind of kept seeing people that were part of my internship experience that had MSWs. And so, one of the best things that when you intern, generally you are a jack of all trades, a master of none. And so they'll send you to meetings, or you'll have this opportunity to just kind of interact with a whole bunch of different people. So that's really where I even learned about Masters in Social Work. It was not incredibly well known, and was, it was a lot of people went the psychology or the PsyD route, get a doctorate in psychology, but it didn't have the whole person approach and the kind of holistic perspective that sociology does. And so that was what made me make the decision to go. And there's so many different ways to do it now. And there are definitely a lot of work opportunities that will provide some compensation to allow you to go back to school. So that is something that, depending on, what your goals are and what, resources you have available to you immediately after, that is a great way to defer it. So Fordham was such a great program because there was a ton of non-traditional students. A lot of them worked for the Department of Social Services in New York City, and they were paying for their degree as long as they worked a certain number of years post graduation for the Department of Social Services. So I had always thought that I was going to do AmeriCorps or the Peace Corps immediately after Loyola, but because I knew what I wanted, I was so excited about it that I didn't want to wait. And so that's kind of what made me choose to go immediately after. I would say, as with anything in life, there's a lot of good to taking a year or 2 years between and getting some experiential learning. School never gets easier, like life happens. And so it doesn't necessarily get easier to go back to get a master's. I'd love Justin to chime in here on this, because he's doing it not immediately post Loyola. But I will say my biggest recommendation is only do it if you know it's what you want. I think it is better to go and get do experiential learning after graduating if you are not 100% sure that it is what you want to do, because it is an incredible, one thing that I love about it is that it is an incredibly versatile degree and can be applied in a lot of different settings. But it is also not necessary depending on where you want to be. So only do it if you are 100% sure, and maybe not 100%. I don't think maybe you can be 100% about anything in life, but I would not recommend, do not discount what an experience would do to help you solidify what path you want to be on if you're not positive.
Thank you so much.